Who has used kinesiology tape before? Have you had a reason to? I don't use it on myself too regularly, but I regularly use it on a lot of my patients, and my husband loves this stuff. So I thought, it was actually Tan and Dr. Mike and I were in our office talking, and we just came across kinesiology and went, that'd be a great workshop. Anyway, so here we are. The science and application of kinesiology taping. So I don't know if everybody saw the Olympics. Did everybody see the tape on some of the Olympians? Some of the volleyball players and different Olympians were taped, and you also saw the cuffing, but that's not what we're talking about tonight. So it's definitely caught on to different athletes, and they're using it more often. Here's two pictures. All right, so what is it? It is cotton, elastic, stretchy, adhesive tape. That is a mouthful. It was invented in the 1970s by Dr. Kenzo Kei. It rose to prominence after the Beijing Olympics in 2008. I think they donated, one of the companies donated a lot of tape. Thousands and thousands of rolls to the athletes in the Olympics in 2008. So that's how it kind of took off. Oh, that's him right there. That's his case. And it is customarily used for the treatment of sports injury, by primary orthopedic chiropractors, acupuncturists, and other medical practitioners. Over 150,000 practitioners worldwide use KT tape in their practice. So when you see KT tape, that's just kinesiology tape. That's the name of it, but there's a lot of different brands. In our office, we carry Cytotech tape, but there's also at Walmart you can get KT tape, and there's all different brands. Rock tape is another one that you get through chiropractic offices sometimes. So it's all pretty much the same stuff. They all pretty much have the same quality. All right, so how does it work? Applied over muscles, the main benefits are to reduce pain and inflammation, improve circulation, relax and support overused, tired, injured muscles, provide structural support to joint and muscle movement, assist healing, and provide support to the injury site whilst allowing full range of movement. So it's not as binding as wearing on the big giant brace. So it still allows, while you're supporting the injury, it still allows motion, so you don't have the joint blocking up too much or staying stiff. Because if you don't keep the joint moving and you don't keep your muscles activated, you atrophy very, very quickly. It was like 5 to 8% a week. You lose muscle mass if you're not using that muscle. So it's very important as you're rehabbing anything to keep it moving as much as you can. So while allowing full range of movement, the taping methods can be preventative or rehabilitative to allow athletes to continue training and competing as injuries heal. The tape may be used with differing degrees of stretch depending on the desired effects of the taping. So this is just kind of a visual of what it does. So you place it on top of the skin, and not only does it lift and dilate blood vessels so you can have more blood flow, more lymph flow, but there's also nerves in here, so it takes kind of the pressure off of the skin, the nerves in the skin, so it kind of relieves some of that pressure, so it helps, and that's how it eases pain. That's how it works with pain. So how is it different than typical sports tape? How is it different than just an ace bandage or anything else like that you can buy? Dr. Case describes KT tape as different from traditional light athletic tape through its wave-like grain, elastic adhesive material, ability to stretch 20 to 40% of its original length, and mimicking the thickness of human skin. So it is designed to mimic the thickness of our skin. And you can see the little waves. So those waves are unique to kinesiology tape. And then it is made with a hypoallergenic acrylic glue. So most people don't have an allergy to it. I haven't had anybody have a reaction. So that's a good thing. Alright, so like I said, when it's applied, the KT tape is said to lift the fascia and soft tissue to produce additional space below the area of application. So like I said, you're getting the skin lifted and you're letting blood flow and lymph flow. We'll talk about that a little bit more later. Alright, these are the advantageous effects. It does increase proprioception by providing constant, continuous, afferent stimulation through the skin. So basically that just means proprioception is knowing where your body is in space. So what it's saying is it is providing constant stimulation to your brain of where that joint is in space. So it is training your brain to know where that is in space. It realigns fascial tissue function by normalizing muscle tension, creating more space for improving circulation of blood and lymph flow by eliminating extra fluid, edema, or bleeding beneath the skin. And we'll talk about the edema and the contusions a little bit more in a minute. Correcting muscle function by strengthening muscle weakness and decreasing pain through neurological suppression. All right, clinical applications. It can be used in treatment and rehabilitation of injuries. So we'll go through a list in a little bit of all of the different, it's used for a lot of different things, but we'll go through more of a precise list of what people have used it for in the past. So there are 3 possible effects depending on the application technique. So you would think you just get the tape out and you stick it on, right? You would think it's that simple. It's really not. It's very, very complicated, and you can get different desired effects by taping differently. And you can have structural benefits, neurological, and microcirculatory. And that's kind of what I already talked about with the lifting the skin off, and you can get that flowing a little bit more. All right, structurally, you're dynamically supporting better postural position. I've actually seen chiropractors use tape to improve posture. We have the posture trainer here in the heavyweights and things like that are shown to improve posture, but there are different taping methods. Posturally, you usually have, if you have poor posture, you have some muscles that are inhibited and some muscles that are contracted. So you can use the tape to contract the inhibited muscles and strengthen the weak muscles and try to help improve posture. Prevents harmful range of motion without a hard infield and reduces strain on affected muscles. All right. Neurologically, enhanced sensory stimulation leading to decreased perception of pain. That was like we were talking about how it does. It sends the body signals of where that joint is in space. Restoration of normal muscle activation and function. It reinforces the restoration of functional stability, promotes peripheral neuroplasticity, and stimulation of the skin's endogenous analgesic system. So that's the pain system. All right, microcirculatory, wave pattern formation, superficial fascial fixotrophy, and that is the definition of that there. Improved lymphatic flow, improved superficial microcirculatory flow. And mechanoreceptors. So this is kind of the mechanism of how it helps with pain reduction. So you have mechanoreceptors in your body, and those are the ones that are pressure or feedback to your brain. And the tape is putting pressure on your skin. And so what that does is it overrides the pain reception. So you put the tape on something that's painful, and instead of sending pain signals to your brain, you're sending pressure signals to your brain, and it overrides that pain, that nociception. And that nociception is just a word for perceived pain. So it does help with pain, and that's kind of the mechanism of how that happens. All right, there's one more diagram of how it works and how you have the inflammation and how the tape does help reduce inflammation. The application. So this is, we're going to go through kind of the rules of application if you are going to take, if you have a roll at home and you're going to use it. And there are a lot of videos on YouTube of different applications. So you can say like, type in sprained ankle KT tape, and there'll be many videos pop up. And that's definitely helpful if you need to do something at home. So your skin should be free of oils and lotions and clean prior to application. I always like to use alcohol pad to clean the skin, and that seems to help it stick on, because if you put on the oil, it's going to not stick as long. Body hair may limit adhesion. Shaving should be done 24 hours prior to taping, so your skin's not newly shaved. Alright, so you want to carefully remove the paper backing without touching the adhesive or letting the tape stick to itself. So it's kind of tricky, but you definitely don't want to peel it off and accidentally touch the tape, because that's going to reduce the stickiness. And then you don't want any stretch on the ends. So as you're laying the tape and you're kind of stretching out, we'll go over different varieties of how much stretch you want. You don't want any stretch on the ends. You want to lay those flat, completely flat. And apparently that's the thing with tape. I never heard that. I was talking to a patient about it, and he was like, yeah, you don't stretch any tape. I was like, oh, okay. So same thing with this. You want to lay it down with no stretch. And you can overlap tape. Like you can have a piece overlapping another piece, but you always want the ends to be on skin. Alright. So you want to tape the joint in a position that stretches the joint. So if I'm going to tape my knee, I'm not going to tape it in a standing position. I'm going to flex my knee and stretch all of that skin, and it gives you a better surface. And if you taped it with the leg straight and then bent it just wouldn't work. So anytime you tape the joint, you want to make sure you stretch the skin as much as possible. All right, these are common application shapes. So usually a fan like this is used for any kind of edema. So if you have a swollen ankle, you can use the fan to hold the edema out of your ankle. And then those are all the different, there's a Y and X and I. Okay. So the elastic qualities of the tape allow for different degrees of stretch to accommodate different effects. Tape stretch tensions are listed as a percentage. It is better to not have enough tension than too much. So you'd rather go on the lighter side and not stretch it as much, and rather than stretch it like way too much. The percentages though, we'll go over the listed, so it'll say like stretch it 15 to 20%. So you'll stretch it at 15 to 20% of its maximum stretch. So here we go here. Full stretch, severe, moderate, light, or taper off. The taper off just basically means the tape is stretched onto the paper a little bit. So if you take the tape and just place it straight off the paper, you're going to have a little bit of a stretch there. Very light and then none. So you kind of have a different variety of stretch depending on what you want to accomplish with your taping procedure. So you can see here, the maximum tension, 100%, can be reached when an original 10-inch Kinesiotech strip is stretched 14 inches long. So it goes from 10 inches to 14 inches, and that's the max stretch. And you can see the ways in that. And that is 100% tension, which you don't typically use that much stretch if you're going to just use it for a lot of different things. You won't use that much stretch. So you can see the no tension there. You can see the fabric, little cross fabric, and then it goes up from there. It goes 25, 50, 75, and 100. And then at 100 it goes from 10 to 14 inches. Alright, so ways to remove the paper backing. I typically like to take the piece of Kinesiology tape and rip it in the middle. And so I have paper backing on each side, and I kind of stretch and then place and then all the way down to the end. So you can do an anchor in, where you peel down a little bit off the end, anchor it down, and then stretch it as you go. That's kind of up to you. But typically I find that I like to rip the middle and make it easier for me to apply. Yeah. So, there are two basic application directions for treatment of a muscle. For acutely overused or overstretched muscles, the tape is applied from insertion to origin to inhibit muscle function. For chronically weak muscles or where increased contraction is desired, the tape is applied from origin to insertion to facilitate muscle function. Has everybody heard origin insertion of muscle? So every muscle has a point on your bone where it attaches and a point where it inserts. So basically like where the muscles anchor on each side. So you have your bicep here and it's, this is where the tendon is, and then it attaches here. So every muscle has two places usually attached or more. Insertion, origin application, tape stretch tension is very light or light, 15 to 25% of available tension. And then origin to insertion application is light to moderate, 25 to 50% of available tension. So here's kind of what I'm talking about. So most of the time, muscles are going to move from insertion to origin. So skeletal muscles are attached to bones on each end by tendons. The origin is the fixed attachment. So here, this is kind of the attachment that doesn't move for your bicep. It goes through the groove here. And the origin is fixed while the insertion moves with contraction to action or particular movement of a muscle. So when you flex your arm, your origin is moving towards the insertion. So that's what I was talking about with different taping methods. You want to tape it this way or this way, depending on what you want to do with that muscle. So that's why it's important to kind of know anatomy, and that's why a lot of professionals use it, because we're taught a lot of anatomy in school. And then there's another. This is the insertion of the gastroc muscle and the origin of the gastroc muscle, and that's your calf muscle. Just to kind of explain what I'm talking about. All right, so the removal of tape. It usually stays on for about 5 days. Our spider tech tape, I've had it stay on for up to 7, but 5, usually 5 to 7. When you take it off, it's easiest to do if it's wet. So after you get out of the shower, you can wet it to try and remove it. You want to go slow. You don't want to rip it because you're gonna hurt your skin underneath it. You remove from the top down, and it kind of explains to push the skin away rather than just pull the tape. So you want to lift it up and kind of just push the skin down as you go. So that prevents you from hurting your skin. Sure. Yeah, so much time.
Okay. So do you do it from the origin first and then insertion, or what's the difference? What are you trying to promote either way?
For acutely overused or overstretched muscles, the tape is applied from insertion to origin. And then for chronically weak muscles, or where increased contraction is desired, the tape is applied from origin to insertion in the direction of contraction. So,
Like chronically weak muscles, what would that mean?
So like I was talking about posturally, where you have, say if you have forward head posture, and you're like this, a lot of times you have weakened, I think it's the cervical flex, you're not going to take your neck, but I'm just saying, you take the posture that you have and you see if there's what muscles correlate that are weakened with that, and then you're going to take it from insertion to origin. That's just kind of getting technical, but a lot of times when I tape, I just aim at supporting the joint. So here are some different clinical applications. This is what I was talking about with the bruising. You can see how they place the tape on in like a fan-like pattern, and it literally, I think it let all of that blood drain out. So it really helps with big bruises like that and helps the blood flow out.
There's no control. You said it's pressure, but you also said that there's the skin, so how does that help?
Well, it is lifting the skin, but it is providing feedback to your brain, pressure feedback. So it's not pressure as in pushing, it's pressure as in the receptors in the arm are feeling pressure. That makes sense. So here is a pregnant woman. She would tape to help support her belly. So it's kind of like you can buy those braces when you're pregnant and it will basically just lift. So that's kind of what they've done there. I haven't used it personally, but I know when I was pregnant it would have been nice. And then that's, like I said, the bruise, and it helps the blood from the bruise drain out. All right, some other things are strains, sprains, arthritis, sore muscles, overstretched or inhibited muscles, carpal tunnel, edema, contusions, like that one, bursitis, spinal pain, shoulder impingement, rotator cuff lesions, shin splints, pregnancy, diastasis recti, post-surgical, and lymph drainage. So my husband has shoulder issues, and he can tell a huge difference because I taped his shoulder, and he knows if the tape comes off within a few days it's hurting again. So it definitely helps, but you typically want to tape for a period of time, but you don't want to have to tape that joint for the rest of your life. You kind of want to do different exercises in addition to the tape to help support that joint more. The diastasis recti, that is the condition where you basically, your abdominal muscles are stretched during pregnancy, and you can tape after pregnancy to help close that gap in. Post-surgical, that's, you don't want to put any tape over the incision or anything like that, but if you had surgery and you want to help support that after the fact as it's healing, it's a good idea. And then lymph drainage, you can, I pulled a lot of research on PubMed, and they are using it to help drain after breast surgery to remove cancer, that you have a lot of lymph flow or backup, and they're actually using tape to help drain that out of, because if they go in and take out lymph nodes, then the lymph will back up, so they're using tape to help reduce that swelling. All right, and pediatric. They apparently make special tape for children, and I haven't used it on my kids, but we'll talk about a case in a minute where it really, really helps a little 3-year-old. But they do make special little prints, and I guess they make it not as sticky, so it's easier to come off. So uses for children: pain and swelling relief, orthopedic treatment, and neuromuscular disorders. So this was actually a patient in our office. I got permission from the mother to use her picture. This was a Dr. Mike's patient back in 2013. He fractured his clavicle. You can see that here, like giant fracture. And then Dr. Mike used, he would get adjusted regularly anyway, but Dr. Mike used kinesiology tape and taped. He basically said, a stroke across here and then an anchor down to kind of pull that clavicle there. And then you can see they took an x-ray a little over a year later, and you can't even see where the fracture was, which is great because I've had patients with clavicle fractures in the past, and it really puts a lot of different biomechanics into your shoulder complex, or changes the biomechanics of your shoulder complex. So hopefully, because he was, helped early on, we won't have those issues later on in life. I thought that was very interesting. All right, so here are the do's and don'ts. We've kind of already talked about some of them, but let's see, clean the skin, I didn't tell you all, round the corners. So if you buy a roller tape and you want to use it at home, you don't want to place the corners down in a square. It's always good to cut around in a circle, a rounded shape. You do activate the adhesive by rubbing the tape briskly from the center toward the end after applying. So if you ever see me do taping, I put it down and then I rub it and I activate the adhesive to help it stay longer. You want to clip or trim hair close to the skin on heavily forested areas. I had a patient today. I told him I could help him with his knee cane if he wanted to shave his legs. he came back from the weekend, he was like, I'm keeping my leg hair. I was like, that's fine, whatever you want to do, but I can't tape over your big bushy leg hair. it's just not going to stay. But he was adamant, he was like, if it gets worse, maybe, but right now I'm keeping my leg hair. I was like, all right. And you can feel free to shower, bathe, or swim while wearing your tape. And then you'll just pat it gently to dry. All right, you don't want to apply the tape immediately before or after exercising or showering. Allow 30 to 60 minutes for the skin to dry completely. Don't apply tape to damage or irritated skin. So this includes cuts, scratches, and sunburn. And that will just further irritate the skin, especially you don't want to touch the adhesive side of the tape. We've already went over that. And you don't want to stretch the tape all the way to the ends. Like we said, you want to lay the ends down with no stretch. And you don't want to also stretch it to its maximum stretch. You don't want to rip the tape from the skin and removing. So gently peel it back, little by little. All right, some more we already talked about don't place it over open wounds, and you don't want to place tape on the back of the knees or the scaling triangle here in the neck. I'm guessing that's just because of more flow. That was a don't. So here's just a little more research I found just after I was searching through what different people have used tape for. The parentheses, that's the research author. There was range of motion and pain improved through taping in patients with degenerative knee arthritis. And that's a big problem with a lot of people with arthritis in the knees, so it's awesome that they can have alternatives to surgery and try to be first in the judgment. There was a patient with metastatic cancer to her T8 vertebrae. So she had breast cancer that metastasized to one of her thoracic vertebrae. And she reported improvement in pain after taking. So I think she actually had a fracture to that vertebrae after the cancer metastasized to it. It became weak and broken. But she did report that the tape helped her with her pain recovery from that. Ankle instability and pain were reduced, and functional dynamic balance was improved after ankle fusion taping for 4 weeks. So I love taping for ankle sprains. I had a patient while I was in chiropractic school still that had chronic ankle sprains. She was always rolling her ankle. And I taped her regularly, and her pain in just a few weeks went from like a 9-10 to like a 3-4, just from you tape for edema. So when you have ankle sprain, you have a lot of swelling and bruising and edema. So you use the fan taping to tape, to bring all that swelling out, and then you can tape to kind of support that joint. So there's different techniques you can use for ankles as well, and it really works well. All right, so KT tape these are just some more research, has immediate effect on muscular imbalance in infants with congenital muscular torticollis. Has everybody seen torticollis? Or they're kind of like, it's the sternocleidomastoid muscle. So the muscle that goes from here to your mastoid. It's in some kids it's a little bit more contracted, so you can actually see them walking around like this. And it happens in children or infants. And chiropractic actually helps well with that as well, but they did report that taping helps with that, and it is a lot better than surgery. I was looking it up, and there's actually people that put their kids in surgery because of it. I would much rather try chiropractic and taping before I put me in surgery.
So where would you place this tape if you can't put it on?
I did not. I can look at the study and see what they did, but I don't know exactly, because maybe they just placed it on the muscle here and then holding it back here. Yeah, I'd have to pull the study off PubMed again and look at it. All right, pain and joint alignment were improved after a 10-day kinesiotape implementation in patients with hallux valgus. The findings showed short-term decreased pain and disability in hallux valgus deformity. So that's a bunion. Ever heard of a bunion? So they had good results with patients with a bunion and that. I mean, that could potentially save somebody from surgery as well, because I have friends that have had surgery on their thalamus deformity.
Yeah.
Right. YouTube. And I love camping, I use it regularly, but I am not an expert. So, yeah. There's actually classes you can take. There's people that